how do you find the right surgeon for you? And when a surgeon is talking about a minimally invasive approach, what should patients ask about that? I'd love to hear our experts say, I wish my patients would ask me X.
Yeah, it's a great question. I mean, how do you find the right surgeon? I think at least how my patients find me is primarily word of mouth through other patients. And I think that's always the biggest compliment for any of us as surgeons, is that if you have happy patients who, feel that they can trust you, they've had a good outcome, or that you've just been there for them through the process, I think is just so important for, it's human nature. And then in terms of the questions, that patients should ask when somebody's recommending minimally invasive surgery, I think there's probably no one particular question, but I think you just want to make sure that you have an understanding of a technique that a surgeon is going to use, and that you feel comfortable with what they're describing to you. At some point, it's a relationship where you just have to give up control and hand it to somebody else, and that's the scariest thing. Having gone through not a spine surgery, but a knee surgery, we're all control freaks, and you need to just kind of hand the control and have trust. And I always tell patients, whoever does your surgery in whatever manner they do it, if you trust that person and you'd go out to dinner with them, then they're probably the right surgeon for you.
That's wonderful. That's a great way of describing that. If a patient asks you the question of, how many of these have you done? Does that upset you in any way? In other words, we want to encourage patients to ask surgeons, do you do this often? How many of these do you do? But I think oftentimes people are afraid of offending their surgeon, or they're afraid to ask that question, or they're shy to ask that question. How do you feel about that?
Oh, no, I would strongly encourage that. I have no problem with that. Tell them right up front what's being done. If it's a new technique, we tell them it's a new technique. Discuss the whole thing with them. I'm also a very strong believer of patients talking to other patients. I give patients names and numbers out. They can go talk to them, discuss with them. Whereas like Dr. Qureshi, there's nothing like word of mouth. There's absolutely nothing like word of mouth. And most patients really have no idea, or very hard for them to understand what they're really going to go through. But I can say it's easy, in 2 hours you're going to get up and go home, but there's a whole lot more than that. What happened later? How do you experience it at home? How do you go through a few days? I think I found really good when they speak to another patient and they really get tremendous information. They're much happier. They come back. And no, I strongly encourage that. And I tell them exactly how many I've done. I mean, and if I haven't done it, tell them I haven't done it. I haven't done it, but I think it's a great technique, and I've done many close to it. But this may be a better way to approach it, and I'm confident I can do it. Well, that's okay. I think that should be discussed.
Yeah, that's wonderful. For both Dr. Qureshi and Dr. Anand talking about the power of the patient testimonial being so important, that's awesome. We at the National Spine Health Foundation tell a lot of these spinal champion stories, people who've successfully overcome a spine condition through a treatment that got them back to their lives.